So in the second part of chapter 5, we're going to talk about healing. And one specific type of healing that we're going to discuss is the healing of burns, the effects of burns and the healing of burns. I have this memory of when I went and took my board exam. The last thing I reviewed before I went in was the rule of nines for figuring out the extent of burns. And I cannot remember if that was on the exam, but I remember reviewing it. So it's in there somewhere. So the learning objectives for this section, I divided it up into the ones having to do with healing and the ones having to do with burns. So for the learning objectives for healing, I want you to briefly to be able to describe the difference between wound healing by first intention and wound healing by second intention, and how this would impact a physical therapy treatment. So we'll talk about that. I want you to be able to list 3 factors that can delay wound healing, and for each factor, explain the reason why the healing process is slowed. What is an abscess? We talked a little bit about that in the last section. And what is septicemia, and how can each occur during the inflammatory process or during wound healing? And how glucocorticoids work and why healing can be delayed in individuals taking them over a long period of time. So we talked about that in the last section, and it'll carry over into this section. So for burns, I just want you to identify the classification of burns and describe the effects and the possible complications that can occur in the first few days after a burn, and explain 3 reasons why healing of a burn may be difficult. So hopefully that's pretty straightforward. So the types of healing of a wound can be accomplished in several different ways. So when there's minimal tissue damage, the healing process is called resolution, and resolution is the process where damaged cells recover and the tissue returns to normal within a short period of time. So the example that I like to give is a paper cut. Ow, it hurts, you have a wound, but there's minimal tissue damage, and within a few days or a short period of time, it returns to normal and there's no scarring or anything. The tissue returns, the damaged cells recover. The example they give in the book is a mild sunburn. So you don't have permanent damage from it. Regeneration is the healing process that occurs in damaged tissue when cells are capable of mitosis. So you have functional cells. So some types of cells, like epithelial cells, are constantly replicating. Other ones, like certain organ cells, hepatocytes in the liver are the example given in the book. They're able to undergo mitosis when necessary, so the liver can regenerate itself. Damaged tissue can be replaced by identical tissue from the proliferation of nearby cells. So this type of healing may be limited if the organization of a complex tissue is altered. So if it's like the liver, for example, if the organization is altered, it's not going to be fully resolved by proliferation of cells from other areas. So sometimes you get distortion of the arrangement of cells in an organ. And so you get nodules of new cells, but they don't contribute to the overall function of the organ. Replacement by connective tissue or scar tissue or fibrous tissue takes place when there's extensive tissue damage or the cells are incapable of mitosis, like in the brain or the myocardium. The cells just are not capable of mitosis. So the wound area has to be filled in and covered by some form of tissue. Chronic inflammation or complications such as infection result in more fibrous material, so more scar tissue. Healing by first intention is the process involved when you have a clean wound that's free of foreign material, and it's free of necrotic tissues. The edges are held closely together. So often a surgical incision is this type of healing, because the edges are held close together by sutures. There's a minimal gap between the edges. Healing by second intention usually refers to a situation where there's a large break in the tissue and consequently more inflammation, a longer healing period, and the formation of more scar tissue. So a compound fracture would be an example because there's just more extensive damage. So this is the diagram of healing in first intention. There's a little suture in there. It's holding the edges together. There's a blood clot that's providing hemostasis. You have neutrophils. There's a little bit of inflammation there. You get granulation tissue and epithelial growth, epithelial regeneration. And there's a small scar that remains, and a little bit of fibrous scar tissue, but it's not extensive. So in healing by second intention, there is maybe a big scab. The edges aren't approximated the way they are in a first intention. There is still granulation and epithelial growth. There's more granulation tissue in collagen than there is in healing by first intention, and a large scar remains. So I always think of it as healing by first intention is like that surgical incision. You have that nice, neat scar. Healing by second intention, you like wiped out on your bike and you have huge road rash and this big area of scar tissue. So, you know, you can think of it however you want to. So with scar formation, you do get loss of function and loss of normal cells and specialized structures like hair follicles, nerves, and receptors. Scar tissue is non-elastic, so it can cause contractures and obstructions, and it can restrict range of movement. Adhesions are bands of scar tissue joining two surfaces that are normally separated. So sometimes with abdominal surgeries or any kind of surgeries, you might get adhesions where things that weren't joined before are now joined by scar tissue. So the process of tissue repair following injury, first a blood clot forms, sealing the area, and inflammation develops in the surrounding area. So we'll go back to healing by first intention and second intention. So whether it's first intention or second intention, you still get the blood clot and a little bit of inflammation in the area. After 3 to 4 days, foreign material and cell debris have been removed by phagocytosis, by monocytes and macrophages. And then granulation tissue grows into the gap from nearby connective tissue. So granulation tissue is highly vascularized, so it looks pink on a new scar. It appears moist or pink or red in color. And it contains many new capillary buds from surrounding tissue. The tissue is fragile and easily broken down by microorganisms or stress on the tissue. So when you're in a healing phase, that's considered a maximum protection phase. You want to protect that tissue. At the same time the wound cavity is being filled, nearby epithelial cells undergo mitosis and they extend across the wound from the outside edges in. So fibroblasts and connective tissue enter the area and produce collagen. And that is the protein that is the basic component of scar tissue, and it provides strength for the new repair. So fibroblasts and macrophages produce growth factors in the local area for the purpose of attracting more fibroblasts. So they produce these cytokines, which are our chemical messengers, and the fibroblasts stimulate epithelial cell proliferation and migration, and promote the development of new blood vessels or angiogenesis in the healing tissue. So you get gradual cross-linking and shortening of the collagen fibers to promote formation of a tight, strong scar. The capillaries in the area decrease and the color of the scar gradually fades. So when you have a new scar, it's pink. When you have an old scar, the tissue is white. That collagen tissue is white. Usually scar tissue is not normal functional tissue. It doesn't include hair follicles or glands. It merely fills the gap. I always say that collagen scar tissue is the spackle of our body. So it's not the same as the tissue around it. It's just filling that gap. As the scar tissue matures over time, it does gain strength, but it may also contract, causing increased tension on normal tissues or forming adhesions. So that's one of the reasons why we work a lot on scar mobilization in physical therapy, because we want to form a nice, functional, flexible scar. So a small area with a minimal, a small gap in the tissue doesn't require very much time to heal. A larger or deeper area, as in with the healing by second intention, requires a longer time to heal. So there are lots of factors that can promote healing or delay the process. There are two little purple boxes in the text that talk about which things promote healing and which things delay the process. So we'll talk about excessive scar formation in a moment, but factors that promote healing are being young, that helps, good nutrition, protein, vitamin A, vitamin C, adequate hemoglobin, effective circulation, a clean, undisturbed wound, no infection or further trauma to the site. Factors that delay healing are advanced age, because as you age, you have reduced mitosis, poor nutrition, dehydration, anemia, because you have low hemoglobin, so low oxygen in the tissues, or circulatory problems. Certain chronic diseases can delay healing. Presence of other disorders such as diabetes or cancer. Irritation, bleeding, or excessive mobility. If you're moving that part too much, it can delay healing. Infection, foreign material, or exposure to radiation, chemotherapy treatment, or prolonged use of glucocorticoids. So glucocorticoids can help with inflammation, but they can delay healing. So they're sort of two sides of the same coin. So complications due to scar formations include loss of function, because we don't have normal cells there, contractures and obstructions, and adhesions. Hypertrophic scar tissue is overgrowth of fibrous tissue that leads to hard ridges of scar tissue or keloid formation. These type of scars are disfiguring, and they cause more severe contractures. The skin and the underlying tissue may be pulled out of the normal position by shortening of the connective tissue. So ulceration is where blood supply is impaired around the scar, resulting in further tissue breakdown and possible ulceration. When scar tissue develops in the stomach following surgery or the healing of an ulcer, this scar tissue also interferes with blood flow in nearby arteries. So it's complications of excessive scar formation. So you want just the right amount of scar formation, not too much, not too little. So you can have that nice, well-healed, well-protected area.